into your doctor, pain management Dr. Alexander Hersel, because so you're using the Botox to really help with the spasms and allowing Geri to do what she does.
Yes, the Botox actually allows us to specifically block involuntary movements in the muscles, which cause a lot of pain and decreased range of motion and mobility. So we can actually use that to make it more functional for her and make it a better quality of life.
Now, I'm assuming, you know, because Botox in the face, for those who are watching with cosmetic procedures, is just small volumes of it. I'm assuming that this is a large volume.
Yes, there's a significant difference in the volume that you need. You're dealing with the same medication. And the cost of the medication is the same, whether it's used for cosmetic purposes or for therapeutic purposes. So you could imagine how pricey that can get.
And now there's a problem, I understand, with Medicare covering these treatments for Geri and others like her?
Yes, there is. And right now with Medicare, there's basically a slight difference in what the medicine actually costs and what Medicare reimburses. And that money, that difference is transferred to the patient. Usually 20% of the cost, which can be anywhere from $400 every 3 months. So you're talking about a large amount of money.
A large amount.
So, Geri, that's something
Yes.
that you've been struggling with then.
Yes. Yes.
And I think it highlights a lot of the, quite frankly, issues with paying for healthcare, paying for medication. According to Allergan, Botox is not an FDA-approved treatment for patients with juvenile cerebral palsy or specifically for chronic pain associated with adult spasticity. You know, there are all these situations where, you know, pricing of medications, reimbursement, it's so very challenging. I mean, I think what I'm hearing from you is you think the best solution would just be update the fee schedule so that someone like Geri gets these medicines paid for.
If only it was that simple.
Well, and we did have to reach out. The Center for Medicare and Medicaid Services issued the following statement to us. Non-cosmetic uses of botulinum toxins can be paid for under Medicare Part B.
But they're only paying for part of it, which Medicare only pays for part of everything, which is a problem across medicine, but for you in particular, so it's leaving you a lot of out-of-pocket costs.
Yes, and without Botox, I can't function.
Yeah.
I mean, I'm in bed. I mean, I need it today.
You know, in your individual case, Geri, all we really want is for you to get the medicine that you need to be you.
Yeah, and so I wanted to just make an offer to you. It would be a pleasure for me to give you Botox for a full year. Compliment.
And anyone watching who doesn't think that these medicines that may be viewed as a cosmetic medicine, all you have to do is look at Geri's face to realize how important these are to her and her life. Geri, best of luck.
Oh, thank you so much.
Dr. Hersel, thank you so much.